Hi and welcome back. Everybody's doing their spring cleaning right now. We're going to talk about something I really dislike, which is brown recluse spiders. Spiders are my worst nightmare, and this bites from a brown recluse spider can turn into your worst nightmare if we're not careful. Let's talk about how to prevent bites from these little critters. One, where do they like to hide? They like to hide in places where you generally don't find people. They have the name brown recluse because they tend to stay away from people as much as possible. Also known as the fiddleback spider, you can see by the pattern that on their body it looks like there's a violin. Where we might find these little critters is places that don't get a lot of traffic. Your attic, your closet, that pile of clothes on the floor that you've been meaning to put away for a long time, sometimes your shoes or boots if they haven't been worn in a long time, places that have dark, quiet nooks and crannies for them to get down in. And when people start getting out their decorations or changing things out in their house, this is when we start seeing a lot of these bites. Spiders generally don't bite us unless it's their last resort. In many cases, it's in your bed and you roll over on it, or it's in your clothes and it's getting crushed between whatever that item of clothes is and your flesh, and so it bites as its defense. It still doesn't mean I'm on their side, just for the record. So, people generally don't feel these bites either. Most of the time, they look down and say, "Oh my goodness, what happened to my arm?" And they notice a spot. I have some different examples that I'll show you here so you'll know kind of what these bites look like. Usually it's sort of a nondescript area of red with fang marks right in the middle. Then after a day or two, it will start looking gray and sometimes blackish in the middle. And if it goes far enough, it will fall out and leave a big hole. Sometimes these are so severe that they require skin graft surgeries and really can be a nightmare. People often mistake these for infections. Sometimes they're very painful and they look horrible, but spider bites are usually quite clean. They don't cause infection. The problems that we see are actually the venom causing the tissue to necrose or die. And you can use all the antibiotics and steroids in the world, but they just don't work. So we're left with what to do. And if you look around, most of the research shows that all the different things that we do are pretty ineffective. We just hope to avoid the bite altogether. One thing that I have found, and I'm not going to demonstrate because you really have to have some training to be able to do this, but is using a low voltage current to destroy the venom. Let's go back to our chemistry classes. The venom of the brown recluse or fiddleback spider is polarized. And how do you denature something that is polarized, meaning has an electrical charge to it? With an electrical current. So I don't use like a police grade stun gun or anything, but a stun gun and just zap around the perimeter. Please don't do this without adult or doctor supervision. So, Dr. Mindy, did I get that right? You do what? Yes, I actually taser my patients. And you may not have anybody in your area that treats these spider bites. If you're in Oklahoma, come see me. I'll taser it for you. I certainly do not recommend this if you have a heart rhythm problem or if you have a pacemaker. Otherwise, it's very localized just to the area where the bite is. And please, like I said, use doctor supervision with anything like this. So if we can catch it early enough before the tissue starts to degrade or necrose, then we can actually watch it reverse in real time. It is crazy and it seems like witchcraft, but I've seen it work over and over again. There are a lot of skeptics out there, and to them I say, hey, bring me a better option and I'm happy to use it on my patients. But for now, it's the best thing I've been able to find. Otherwise, we just have to let your body process the venom out. Sometimes they can get infection, and sometimes antibiotics and steroids are appropriate. But if we catch it early enough, this seems to be the best thing that I've found. So while you are doing your spring cleaning, etc., this year, make sure and wear tight-fitting clothing and keep your arms and legs covered. Keep everything tucked in so hopefully these little critters can't get in there with you. But seek medical attention if you think you might have a spider bite. Don't forget to like and subscribe and stay tuned.